This is Bringing Better Health to Life, sponsored by Conway Medical Center. My guest is Dr. Ross Taylor. He is an orthopedic surgeon with Coastal Orthopedic Associates. Welcome to the show.
Thanks, Diane.
Tell me about your background and how you got to Conway Medical Center.
Sure. I was raised in the Washington, D.C. area, and I trained in orthopedics at Georgetown University Medical Center. Before that, I went to medical school at Medical College of Virginia. And after completing my orthopedic training up at Georgetown, I did a one-year fellowship in foot and ankle surgery with a physician, a world-renowned surgeon at University of Cincinnati Hospitals.
Tell me a little bit about your practice here, Coastal Orthopedic Associates, even perhaps who you practice with.
Of course. I am a member, as you said, of Coastal Orthopedic Associates. Coastal Orthopedic Associates is the most well-established practice in the Grand Strand area with respect to orthopedics. It was started over 25 years ago by Dr. James Yates, who I've had the privilege of knowing for some time now. Dr. Yates started this practice when he came out of training, was joined then by Dr. Haskin, a hand specialist, Dr. Pressler, a general orthopedist with an interest in shoulders, Dr. Mills, who does spine, me, Dr. Elliott, who does sports, and we recently have the advantage of Dr. Peter Ramsey joining us, who's a specialist in joint replacement surgery. So we really have all the body parts covered.
It sounds like an incredible team.
It's been a real opportunity to work with them.
I want you to talk a little bit more about your specialty, because many times I've met orthopedists, but they work on all body parts, not just a specialty. And I think it's fascinating that you really do specialize in foot and ankle.
Yeah, Diane. At Coastal Orthopedics, we've taken a pride in going a little bit above and beyond with respect to training and specialization. That's why almost all of our physicians have fellowship training in a specific area of orthopedics, and as you mentioned, for me, it's foot and ankle. And fellowship training enables us to focus on an area of the body to provide an additional level of expertise that another orthopedic surgeon wouldn't bring to that area. For me, as a foot and ankle specialist, you know, you may, when somebody out there is having pain, a problem with their foot or ankle, whether they're an athlete, somebody with diabetes, or somebody who just has a painful lump or bump on their foot, they have a wide range of choices when it comes to health care. They can go see any foot doctor. And what I want my patients to know is that when you come to see me, you're not really just seeing a foot doctor. Basically, you're seeing a medical doctor. Not all foot doctors are medical doctors or go to medical school. But I did. I completed medical school. And then beyond that, I also bring the training and experience of an orthopedic surgeon to the table as well. And that's that I completed a 5-year course of training in orthopedic surgery. And that's where we learned orthopedic techniques as they apply all over the body. In doing a foot and ankle fellowship, I was then able to learn how to focus those techniques on the foot and ankle. Spent a year training just doing reconstructive work on the foot and ankle. And then since that time, I've practiced almost exclusively in the area of foot and ankle. Seen over, I think over 10,000 patients in the 10 years I've been here with unique foot and ankle problems. And then I've done over 4,000 surgical procedures specifically on the foot and ankle. So I want my patients in the community of Horry County to know that when they make a choice to see a foot doctor and they see me, they're getting the benefit of that experience and training. And not to mention the personal touch that I like to bring to all my patients.
And I heard you do just that. In just a moment, we'll be back to talk more with Dr. Taylor about foot and ankle issues here on Bringing Better Health to Life. Stay with us.
The Conway Medical Center website provides visitors with a comprehensive resource for their health and wellness inquiries. From our homepage, just click onto Search Health Topics for direct access to the HealthWise knowledge base, where you'll find over 5,000 topics about health conditions, medical tests and procedures, medications, support groups, and everyday health and wellness issues. At Conway Medical Center, we know that better informed patients make better health decisions.
For over 50 years, it's been our mission at Garden City Furniture to offer our customers quality home furnishings at an excellent value and to provide personalized service that is second to none. You'll feel at home at Garden City Furniture on 17 Business in Garden City.
This is Bringing Better Health to Life, and we're talking with Dr. Ross Taylor. He's an orthopedic surgeon with Coastal Orthopedic Associates. And you mentioned a moment ago when we were talking about your specialty, how you work with diabetic patients. And I would like you just to address a little bit more about that, because we know that the foot care for a diabetic person can be life or death.
Yes, that's absolutely true. You know, Horry County has a large population of people with diabetes, unfortunately, and but fortunately, if diabetes, if taken care of properly, doesn't have to cause any necessarily cause any premature or ill health effects. One of the body parts that diabetes is the hardest on is unfortunately the feet, and I would just like to emphasize that preventative care with respect to your feet, if you have diabetes, is very important. And that really includes seeing a foot doctor, preferably me, who can take a look at your feet and evaluate you for specific risks, such as for ulceration, deformity, and make some specific shoe wear and foot care recommendations that can prevent some of the tragic problems we see in people with untreated diabetic foot disease.
There's a million other things I could talk to you about pertaining to diabetes, but I'd like to move on to some other topics. And one would be the fact that there are a lot of people now who are exercising to stay fit, and they push themselves. They have a foot problem or an ankle problem, and they keep thinking, well, it's going to go away. You know this best because you work with the Coastal Carolina University track team. When do we know how far to push before we see the doctor?
Well, that's a good question, Diane. I come at that issue from two perspectives. One, you know, as having been a competitive athlete myself, I understand the drive to stay in the sport, to stay competitive, and to try to train through injuries. And I see that so much in my athletes at Coastal Carolina University. The last thing they want to do is have to modify their training routine. You know, they've got a specific goal in mind. You know, they've got a meet coming up, a race coming up, and with a lot of my community athletes, quite often it's the Myrtle Beach Marathon coming up, and they don't want to fall off their training schedule, but they're hurting. What I want people to know is that just because you're hurting, it doesn't mean that you're going to have to stop training for whatever you're doing. Now, you may have to modify your training routine, but if you're hurting, the important thing is that you don't try to work through it. That's how I see athletes get stress fractures, and those, unfortunately, you know, that can cause an athlete to really miss their goals. I mean, that can really take them out of training. I so often see them and wish, gee, if you'd come to see me, you know, a month ago or 6 weeks ago, you know, we'd be having a completely different conversation. You know, we'd just be training, you know, changing your training routine, and keeping you, you know, working towards your goal of getting in the race and running a good time. You know, it just is so important with an athlete who's trying to take great care of their body in training that they listen to their body as well. And, you know, if they're having chronic and recurrent pain when they're running, that they come to see me. I can provide a lot of insight into all matters of running injuries and all matters of sports injuries as they relate to the foot and ankle. That was a big part of my training, and it's been a big part of my practice. It's been a real privilege to be involved with the Coastal Carolina University teams.
We have about a minute to go, and I want to address the fact that you also work with people who have problems like bunions, hammer toes, and even, of course, senior citizens who are having difficulty with their feet.
Of course, Diane, people of all ages can have problem with their feet, everywhere from children on up into adulthood and into one's senior years. And I find that my retired patients are the ones who tell me that they have the least time for these issues. And you know, whether it's a bunion, a corn, a hammer toe, what I bring is, 10 years of experience to the condition. I bring the orthopedic surgeon's perspective to the condition, and of course, my own level of what I feel, a personal touch to every person's problem. Don't ignore it. I mean, if it's preventing you from living your life, the way you want to live it, if it's preventing you from the type of, shoe wear that you've become used to, you really need to see me, and we need to talk about the options, which aren't necessarily surgical.
Dr. Taylor, I can tell you, you are tops in this business.
Well, thank you, Diana. Appreciate your perspective on my practice, and I really appreciate the opportunity to talk to some of the patients out there.
Again, thank you, Dr. Taylor with Coastal Orthopedics. This has been Bringing Better Health to Life, brought to you by Conway Medical Center.